So thanks for showing up here. I'm going to kick us off by submitting my health check because I have not done that yet today. I assume that everyone in this meeting now is here because none of you submitted yours. You're getting spammed by email notifications and things. Zach Walker is our presenter today. He's been just a total rock star helping out with all of the data associated with these health checks that we've had. It's been a crazy year, of course, but having people like Zach, Mike Sharkey's helped organize everything. It's definitely made it a lot better. So very excited to share with you what Zach's been working on and the rest of the team. It's very cool that we've been able to be a part of this little effort, along with all the cool things that BioDesign Institute is doing. So take it away, Zach. He's awesome team member. So happy to be, anywhere near your team. Data solutions folks at UTO are awesome. So go ahead.
Thank you, Dixon. I did try and pull off a mohawk look like you were sporting yesterday in John Rum's morning presentation. Wasn't quite able to make it work. I've been going with the self-cutting method during quarantine. So a very uniform buzz. But anyway, yeah, as Dixon said, I'm Zach Walker. Quick introduction to me. I like to think of myself as the ASU triple threat, as I am an alumni, a staff member, and also a student. I'm working on a master's degree. So really immersed in the ASU ecosystem. And it's probably because of that that I ended up working on this health check stuff. So today we're just going to go over a couple things. We're going to start with HIPAA compliance. We'll talk a little bit about the team and a little bit about the development process behind the health check application as a whole, and then also the reporting. And then we'll sort of follow a health check throughout its journey, so to speak, and then we'll take some questions at the end. So if we could, questions in the chat whenever, but we will get to those at the end. So very important to note, the health check is not HIPAA data. It's essentially the equivalent of me calling up my boss and being like, hey, I've got a little cold, I'm gonna be out sick today, whatever, anything like that. ASU doesn't get the data on whatever symptoms you may or may not put into the health check. Just get a very simple field. Are they feeling well or not feeling well, essentially? So really not any concerns there. Just wanted to cover that at the beginning. So this is sort of the main team for reporting. Obviously pretty big, a lot of people. Give just a quick overview of what each of them does. So Tim Bernard is our awesome QA guy. He goes through all of my code that I've written while hopped up on Mountain Dew and Doritos at 3 in the morning and checks to make sure that I did not misspell things, which has happened once or twice. Roger Davies is awesome guy. Work in parallel with him. I do the dashboard code and he does the email reminders code. So Jesse and David Holtz, they both handle getting all of the health check data into the database. We've got some cool functions for that we'll talk about in a little bit. Delaney Dickerson is a freaking rock star. She's in charge of ODS. She has worked with me to optimize so many different queries and taught me so many different things that I had no idea existed. Linda is our project manager. She really keeps us on track, which is awesome because as you're about to hear, we built this really fast. And the phrase building the plane while flying it was used a lot. So if you do not have an awesome project manager, that can hurt. Bobby and Zohair and Kelly Mukherjee are all the mobile app people. Kelly's the project manager. Bobby's sort of the managing director, I believe. And then Zohair is the head of the development team. Joe McDonald writes or runs the Edna database. So he's not responsible for all the password requirements, but responsible for making the code runs. Grant runs Tableau Server, and he has also been just incredibly helpful in this, and we'll get to that. And then throughout the rest of these here, pretty much everybody other than Jonathan. Jonathan also works with Delaney on the ODS side, but the rest of us here are all on the reporting side. Dixon handles tier 2 support. He's the one that gave the awesome introduction, and I'm sure, well, I hope none of you have had to interact with him through tier 2 support. I hope it hasn't gotten that far, but if it has, he is a pleasure to work with. So I'm sure that you guys got that figured out. And then Elizabeth and Mike, obviously my supervisors. And so they, as I like to say it, they handle the people so that I can just stay locked in my small dark room with my Mountain Dew and Doritos. So the agile development cycle for this app has been frankly insane. I was talking to Zohair about it, the head of the mobile app development team, and he says generally when they're developing a new feature in the mobile app, they get about 4 sprints. A sprint is usually 2 weeks, so they get about 8 weeks to develop that. And for the health check, that team had 2 sprints to get that done. So half the normal amount of time. Obviously, much more important that it works 100% because not all of the features in the mobile app get used by roughly 70 to 80,000 people every day. And then it had to be developed, obviously, to work on the app and the browser, and a special version was developed for the experience center so that anyone calling in, they could handle that. He also mentioned that generally prior to the first sprint, the team gets a set of requirements. So, it has to do A, B, and C. And then A, B, and C aren't supposed to change until you get to the end and you sort of take a minute to go back and look at how they turned out. That didn't happen here. Requirements were changing almost every day on the building side. Requirements were changing almost every day on the reporting side as well. And so that was insane for the mobile app team. And they also the testing. So usually they have a very long testing phase. For this one, they actually just pulled in a bunch of ASU employees into early access testing and sort of did the best they could, because obviously the semester starts when the semester starts. We're not pushing that back just for health check. So there may be some, as people may have noticed, some little issues with the app here and there. But development has definitely continued, and they are working on getting that figured out. And I think we're in a pretty good point as of right now. And then on the reporting side, as I mentioned, also very agile stuff, also changing every day. Roger Davies and I are in the same GitHub so that our code for compliance versus non-compliance is always in lockstep. And I think just yesterday he pushed GitHub commit number 151. And the health check's been live for about 3 months now. So 50 commits a month, that's over a commit, almost 2 commits a day. It has been a exciting experience, to be sure. But let's go over a day in the life of a health check. So obviously we saw Dixon fill out his. I have not filled out mine yet. Thank you, Dixon, for the reminder to do so. But this is a pre-recorded one, as the live demo, something would probably break. I hope all of you are familiar with this screen. This is the mobile app version, obviously, but it looks roughly the same on the website. If you are not familiar with this screen, you are already on a list, so please be aware of that. So like I said, the app was designed and built by Zohair's team, which was sort of managed by Kelly Mukherjee. And obviously it's gone through a couple different iterations, but this is step 1 in the health check. You take the health check. And from there, it goes down a stream of a bunch of different things. So all the data from the ASU mobile app lands in a product called MongoDB. It is not really a structured database. So for those who don't know what that means, it's akin to just tossing everything in your grocery bag all at once, instead of, putting the boxes on the outside and putting the bread in the middle so the bread doesn't get squished, stuff like that. And that's just the most convenient way for the mobile app team to store it, because if the mobile app ever needs to retrieve stuff, it's much faster. Like if you just need to grab something out of the bag, it's much easier to just reach in rather than to carefully reach your hand around and under things to pull it out. So then, as I said, David and Jesse have cooked us up an AWS Lambda function, which that's a pretty technical piece of knowledge even for me. But it essentially just gets all of the data from the Mongo database and puts it in a nice orderly line, so that the ODS can import it very easily without having to do a ton of work. ODS, some of you may or may not be familiar with that phrase. It stands for Operational Data Store. If you don't know what it is, you've probably seen it used by accident, because it's where stuff like MyASU and Canvas get information like your name. It's a database built for web applications to just look at. And so sort of adapting it for reporting is something that we haven't really done before. Generally, all of our reporting is done by a different database that is built for that. And so part of that query optimization that I mentioned has been working with the awesome Delaney Dickerson in figuring out just how to do that. What changes have to be made where in queries. We had to get a bunch more processing power for the ODS. We have to run stuff at specific times so as not to interfere with other things, stuff like that. And it's really just a good example of, we don't have a perfect solution lined up for something like health check ready to go, but we're able to adapt what we do have to the purposes that we need it to be. And then finally, Tableau, which is my area of expertise, my domain. It's an awesome piece of software, very similar to Power BI, if anyone's used that, that you use to build dashboards. And so ASU has a Tableau server that we can publish to. Everybody can, or not everybody, but people can log in and see reports and dashboards that have been published on there. And so there's been a bunch of stuff going on with that too. So that's Grant Merer's job. I mentioned him earlier on that team slide. He's the administrator for that Tableau server. And he's done some crazy stuff on the back end to make sure that we're getting this data in a pretty close to live format. Because obviously with most dashboards that ASU has, like student retention and stuff like that, refreshing it every night at the wee hours, 4 a.m., something like that, is fine. But with this stuff, we need it to be a little more live. So we've got it set up to the point where it's refreshing once an hour, and that required a lot of experimentation, a lot of learning on Grant's part. And so we are just super thankful that he was able to get that set up. And at this point, it's going off without a hitch. We definitely hit some hitches earlier, but again, building the plane while flying it, here we are in November, and it is working. Then we can also send out, I don't know if most people may or may not be aware of this, but Tableau server can actually be configured to send out reports to like an email address every night or every week or every month, stuff like that. And so we've got a bunch of those set up to email off to the important people, essentially. Like for instance, Mike Sharkey gets somewhere between 3 and 5 emails a night from health check stuff. So they don't have to go and get it. And that's just, I feel like that's just an under advertised feature of Tableau server. It's super useful. So we've got a bunch of dashboards. These are the main ones, obviously employee compliance and student compliance. We also have a couple dashboards built for Dixon. So like I said, he's tier 2 support, and it's easier for him to just have a dashboard for that than to have to query the database himself to figure out why someone's getting reminder emails when they shouldn't, or their health check isn't submitting properly, stuff like that. We've got a couple different dashboards about password resets, and then some other dashboards that also head up to the executive committee. And we are actually able to take a look at a couple of these today. So this is the first one. This is the employee compliance dashboard. I grabbed a screenshot from Tuesday. As you're about to see, as you will see later, I should say, the 54% compliant is actually generally a much higher number. It's just that I grabbed this at around 10 a.m. And generally, we've noticed people get those reminders at 10 a.m. either through email or through push notifications on the app, and that's what prompts them to go do it. And that's not a bad thing. That's perfectly fine. That's reminders working as intended. But we can see here there's a couple different ways to look at it. We're looking at what percent of people are reporting as working on campus. And obviously that's really important because we want to make sure that that number is not going too high, especially with the spreading of COVID again. And then we look at potential password expiration and actual password expiration. So as you can see, we've got about 3,500 who have ever had a password expired out of, is that like 15,000-ish? And that's pretty good, especially considering that passwords can, that can happen as an accidental process. Somebody forgets to take a health check, doesn't see a reminder email, stuff like that. And so we're very happy with the employee rate of not doing that, essentially. We take a look at it in a couple different ways, but the main breakdown is faculty staff. We also break down by campus occasionally, but for stuff like this where it's just compliance based, it's generally a pretty flat number between all the breakouts. And I just realized I use this phrase compliance. Obviously, I am well aware of what that is, but for any who aren't, compliance is the ways that you are compliant with the health check. That was a great way to phrase that. You can either fill out your schedule to say that you're not working on a certain day, or you can fill out a health check. Essentially, those are the two ways to be compliant. So as you can see on this graph, there's about 20% of people already compliant at 6 a.m. I'm guessing not a lot of people are getting up at 5 a.m. because they're so excited to take their health check. So we can assume that most of that is due to the scheduling. And then the student one, which I do not have a screenshot of, but visually looks exactly the same as this one. I literally copied it over in Tableau and switched out the data stores. It's a work smarter, not harder. It is much the same. So they also have the ability to set schedules for when they will or will not be on campus. That rolled out around the beginning of October. And we've seen that get used a lot. And we're really happy about that because obviously there are a lot of students out there. I'm sure you've seen them on social media or wherever, unhappy that they have to take health checks despite living off campus and attending only Zoom classes. So we've been able to work around that now. We're very happy with how that is working. Because while the number of health checks that students are taking is going down because more and more of them are using that feature, their compliance rate is staying very steady at around 80 to 90%, which when you're dealing with 70,000 students is pretty good. So yeah, that's this dashboard. We also have password resets. So obviously, your password gets expired if you are on day 2 of not complying with your health check at, I believe, 3 p.m. And so we do track that just to see, what is the impact. And we can see here, looking at this, to most people that it even happens to, it only happens once, which we feel is indicative of either a bug with the app causing schedules to get messed up, which has happened a couple of times, or somebody just forgets to do a health check one day, 2 days. And that's the idea that it only happens once is pretty good. We're willing to take that. We've got some edge cases, obviously, out here. You may not be able to see my cursor, but out here, we've got some students who've been expired quite a lot. And we are still looking into those, seeing if maybe it's someone who's not supposed to be there. Because for instance, when we launched the health check in the first place, we were reporting off of a employee population that included people who were no longer at the university, just because their records were still in whichever database we had used to pull that employee population. So this one you may be familiar with. This is one that was built by both myself and Mike Sharkey. We had some collaboration on this one. It is the one that is published every day or week or so. not exactly sure what the update timeframe is, but if you go to the ASU COVID management webpage, this is sitting right there at the bottom. And so we can see here, like I mentioned, the number of health checks is going down. But ever since early September, the rate of essentially your health check coming back, hey, maybe you shouldn't be on campus today, is very low, and is staying pretty consistently very low here for the students. And then for employees, basically the same thing. No fall off pretty much at all, because most people work Monday to Friday. You'll see a couple bars that are lower, but like that one right there was Veterans Day. Over here, this was another holiday. And we can see here too, it's remained very, very flat here. It looks a little jagged, but if you take a look at the axis rate, it's only going between 0% and 0.8%. And we've got that specifically so we can see, you know, if you blow this out to 100%, it is just a straight line across the screen. There's not a lot of usefulness there. Let's see. Next one here, and this is an exclusive look at one that is generally sent to the executive committee. So this is what it's looked like for the last week. We've got percentage of employees on campus, percentage of students on campus, the employee and student compliance, and then the password expiration. So right off the bat, you may be looking at this and going, dude, whoa, what happened on November 14th? Why is that so low? That one's on me, essentially. This is another instance of building the plane while flying it. If an employee does not have a schedule, we default them to Monday through Friday, which in code speak is days of the week 0 through 6. Because if you start counting at 0, you only get to 6 being Saturday. When I was writing the code for this, in my infinite wisdom, I forgot about that. And so I wrote 0 to 7. So on Saturday, if you did not have a schedule, you were assumed non-compliant, which is why that dropped down to 50% of people there. Because you know most people are not waking up, like I said, bright and early on a Saturday morning to take their health check, right? So that is why that happens. And that's happened a couple of times. We had an issue a couple weeks ago where a lot of you were getting reminder emails that shouldn't have been happening. But you know, we're on it. We're making continuous improvements. I took this screenshot yesterday, and I then fixed it after yesterday. So if we were to look at the version of this dashboard for today, that would be, I believe, like 99.3% compliance for employees on that day, which is typical of weekends. We love to see it. Really high compliance rate, made easier by the fact that unless you deliberately schedule yourself to working on weekends, you don't have to take a health check. Likewise, we know that Dr. Crow really loves to see this percentage of people on campus. He's a big fan of that. And that, you know, prior to around the time we rolled out scheduling for students, which was in early October, late September, somewhere in there, that wasn't really an available option for students. Up until that point, students were required to take the health check 7 days a week, regardless of where they were. It doesn't matter if you're in Hassayampa or Alaska, you got to take the health check every day. And so since we implemented that, we've been able to really look at the percentage of students on campus. And that's been really helpful to leadership in determining a couple different policies. Just because, hey, if you've got 80% of students showing up to campus, that's very different than 10% of students showing up to campus, but it's tough to, you know, look out your window and sort of accurately gauge that. We've got password expirations over here on the right, nothing crazy new there. And then we display all of the raw data down at the bottom, just in case there's any questions, essentially. And I have really flown through this because it is now time for questions. If anyone has any questions, more than happy to answer those. Let me see, I do see 5 things in the chat. Okay.
I have a question.
Sure.
Are there any, what's planned for the future for this? Are there any plans for improvements or updates to it that you might want to let us know about?
Yeah, I mean, the big one, the big, master update that recently rolled out was the 3-month calendar feature. Because prior to that, we essentially had a flat week schedule. But in addition to making it very hard for us on the reporting side to marry the Sunday through Saturday to dates, it also allows people to set up their schedules and then forget it. Like I've already gone in and set off my Christmas dates and Thanksgiving dates and stuff like that. And so now I know I don't have to touch the schedule again until like January. So that's been great. As far as future updates, there aren't any big plans that I know of right now. I think leadership is of the opinion that this is in a pretty steady state in terms of app functionality. Everything is, knock on wood, working as intended. The scheduling feature is in a good place and is available to both students and staff. And then there's a bunch of other stuff happening with the mobile app right now that is pulling the development team to that. Like for instance, Sun Devil Rewards is being bundled into the mobile app as a whole. And so that's a big project for them. So Mike is here though. Mike is one of my bosses and may well have a different answer for improvements to Health Check app. I'm not sure.
Yeah, from my side, it's not something we want to keep adding features to. It's just sort of a, hey, you do your health check. So unlike the mobile app or different tools where like you want to add more features to make it more useful, you kind of want this just to be part of what we do. And so we want to make it easy, like Zach said with the calendar. But it's not, I mean, whatever we can do to make things simpler is better, but there's sort of a finite limit to that. End of the day, it should just be you do your health check, click a couple of buttons, and you're done. And for many people, that's what it is. You get in a routine, click a couple of buttons, check in, you're done. Set your calendar, you're good. And so we're kind of at a point where, I mean, as we know, this will be here for a bit. There's no end date in sight for health checks. And so we're in an okay spot there.
Then we've also got a question from Nancy. Who gets the viz that I just showed for an on-campus student? Is that this one, but for student you were talking about, Nancy? If that's correct, this one is available to. I know Philip gets it. Philip Scharf gets it every night. Alicia Raddatz gets it every night. And then there's a group of people, the security group of people essentially who are allowed into the health check dashboards is about, I think it's up to like 50 people at this point. And so they'll have access to it as well.
No, it's the last one that you showed.
Oh, this last one here?
Yeah.
Yeah, so this one is emailed to 6 or 8 people every night. Elizabeth, Mike, Lev. I think Philip should be getting this one as well.
And Lev shares it with an executive committee. So it's...
Does that include deans?
It includes provost office, not all the deans.
Okay, if someone in a dean-like area wants to have, it doesn't necessarily have to be visualized, but our career center wants to know how many students are on campus for planning for career, like recruitment from employers. So can I ask you, Mike, to...
Yes, connect with me. We're actually doing some other stuff with tracking how many people are around campus. So yes, send them my way, Nancy, absolutely.
Thank you.
And then a question from Kathleen about how are these checks being used to generate who gets selected for random testing? It's a good question. The process is different for employees and students, and has also there's been a lot of ping pong about how one side of the aisle thinks it's working versus how the other side of the aisle thinks it's working. Mike, do you have any clarity on that?
Yeah, so we have a couple of data points. So first of all, the folks in biodesign who do the testing, I am impressed as heck as what they do. So, we're a bunch of data nerds, and we want to make sure we're doing accurate reporting, and we're really good at the data. But sometimes we forget to zoom out and like, hey, what is it that we're looking at? What do these data represent? Oh, that's a human being. I should be careful about how I do this. Biodesign folks, that is their bread and butter. They're like, this is about safety and health and security. How do we approach it? So it's a wonderful partnership where they always have that in mind, and we keep each other kind of in check with those things. So biodesign and doing random testing, they want a methodology of testing that gives us a good solid feeling that we have an idea of if there is spread of COVID on campus. So that's what they're looking to do. We provide them with a couple of data points that they can use for that. So one is the health check data. So as Zach has shown, and as we all know, if you are a staff, you answer a question, will you be on campus or will you be on campus today for work? And if you are a student, you can also set in your schedule, will you be on campus on that day? So we have self-reported information of will someone be on campus. So biodesign takes that as one chunk of data to use for testing. And then the second thing is we've started to look at some data about individuals who are connected to the ASU Wi-Fi. So if someone is connected to the ASU Wi-Fi, you're likely on campus. Now, as I learned, I'm in the USB building just off the edge of Tempe campus. If I walk down to Potbelly, I actually stay on the ASU Wi-Fi the whole way there because there's a maintenance building right by the Starbucks and the Potbelly. So it's not perfect. We have some dorms that have a non-ASU SSID Wi-Fi. So there's a couple of big dorms that have non-ASU Wi-Fi. So we don't have 100% of who's, and then obviously there's more than just Tempe campus. But we help biodesign by giving them the check-in data from Health Check-in and some ASU Wi-Fi data, and then they use that to derive a methodology about checking for random testing. So we've had a couple of one-offs. I got someone from lives out of state and said they got a note saying, hey, can you please come in and get tested when they don't even live here? So it's not perfect, but they do a really good job. Kathleen, any other questions on the random testing?
Yeah, because I'm just trying to figure out how I was selected 4 times for random testing, and yet my boss was in 4 months, and my boss has been selected once. And we're both on now I'm on campus a little bit more frequently, but he says he is putting into the system that he's going to be on campus that day too, and sometimes he just doesn't make it in. So I'm just kind of curious on how the system's working to generate it, the coding and that, or how the system decides.
Sure. So I know the team's been adjusting. So Tim Lant, who did our keynote on Monday, he's key in doing part of this. A few of us meet every week. I don't know the exact methodology. I know it's changed. We've adjusted it a few times. I'm on campus every other week. I'm here in USB, and I've never been picked for random testing. So I've also gone in for testing voluntarily to do my spit test. So I don't know if it takes into account if you've gone voluntarily or not. So I honestly don't know the specifics of it. It could just be the random part of random testing, but I don't know the details. What we want to do is we want to get as representative as possible. One of the problems is we were doing it reactively. So we took the data from last week of who was on campus and used that to do this week's random testing. Well, a lot of us do alternate weeks, so that kind of messes it up. We have holidays coming up. We have holidays in the past. So the team is really trying to do what they can. But again, these are biomedical engineers, data people, and healthcare professionals. And so they're trying to make sure it's representative. which I love that it's not just a math nerd like me saying, oh, if we do a 7% sampling with this percent response rate, we'll get good coverage. So sorry, Kathleen, I don't have the details because I'm not in the room with those folks, but I know it's adjusted a couple of times to make sure that it's as representative as possible.
All right,
Hey,
thank
Mike.
you.
Hey, Mike.
Yeah.
I thought I'd let you know I've been on campus every day, 8 hours every day since the pandemic started, and I've only been picked once. And we have people here on the 6th floor very intermittently who have, like Kathleen, been chosen 4 times. So
it might just be the random part of random testing. I'm pretty confident we're not singling anybody out, but again, I don't have the inner workings of the methodology in front of me. But
And I mean, I've got an example from like the flip side of that almost. The wording of the health check is also, will you be interacting with another member of the ASU community? And both of my younger sisters attend ASU. And so one time I was picking one of them up to drive us both up to our parents' house. And so I said, yes, I'm interacting with another member of the ASU community. It was some Saturday. And that was the one and only time that I've said yes to that. And I was selected for random testing. So it's really very much their area of expertise, just to add on. So we've got a question from Aaron. Do other universities do health checks as well? Part 1. And do we think that ASU is having an impact on the higher education community as a whole when it comes to our daily health checks and potentially influencing other institutions to do the same thing? I don't want to punt every question to you, Mike.
I got it. So it's a great question. If you Google university COVID dashboard, you'll see North Carolina, Michigan, a lot of schools actually publicly publish their dashboards. Not a lot do health checks to the level we do. We're fortunate in that we have the mobile app, which is already a vehicle into someone's, it's also web as well. So, I'm thinking of the colleagues I know at different universities, and most don't do like a daily check-in to the level that we do. And so, are we having an impact on the higher education community? Potentially. It's a good example, and we've actually had a couple of things. Some of the vendors are like, "Hey, ASU, do you want to share what you did because you used, us?" Actually, Tableau was asking us to do something about COVID and health checks because we use Tableau dashboards. So we don't mind sharing that. We put a lot of time into it. We think it's helping the safety of our community. But do we think we've had an impact? I'd like to think so. I don't think realistically it's a measurable one. Everyone, my brother works for a small college in the LA area, and most people are really looking inward, like how do we handle our students? How do we support them? I think in May or June, a lot of people were looking outward. What's everyone else doing? Are they staying open? Are they going online? Are they shutting down? Now that I think everyone's in their groove, I think everyone has their way to go. So I think we are a great example. I'm obviously biased because, my team has contributed to what we're doing here. So I think we're a great example of how to use this, how to use technology and data to help support what we're doing. But man, at the end of the day, this is a human thing. If there are folks from EOS here, like you guys are all awesome. You're just dedicated to students and helping them. And sometimes that's a person-to-person thing. Early on, we talked about, hey, we could use this and that, like use RFID or NFC on a phone to see if someone is near someone. Google and Apple have the contact tracing where through NFC, 2 phones come near each other. We had all these different things. And some folks in EOS and even on the healthcare side were like, look, this is a human thing. Like, we'll talk to people, we'll figure it out. And so I think it's great what we've done. I'm being a little modest and saying, we're not changing higher ed when it comes to health care, but I think we're a great example, and we love sharing with other schools what we've done.